in your clinic. When you're aiming to a person, you have type 2 diabetes, therefore you have a choice. We have tablets we can use to treat you, supervise your demise, or on the other hand, we could approach this from the point of view of saying this is a reversible disease. Do you want to engage with this? Now, not everybody passionately wants to get rid of their diabetes, but a surprising number of people do and can. But you can explain to them in advance what the chances are. If you lose 10 kilograms or more, you have a 2 out of 3 chance of going back to normal. 64%, about 2/3. So far, so good. The road ahead is looking just a little clearer. May still be difficult to disentangle some parts, but at least we're in a position of clarity. But does this idea of type 2 diabetes being so simple, we can describe it in this very simple way? Too much eating, too much liver fat, everything goes downhill from there. Because the proponents of heterogeneity say, look, that cannot be right, because there are some people with a normal BMI who get type 2 diabetes. Now, particularly in India, there are many people with a normal BMI, even adjusted for the Indian population, who get type 2 diabetes. So we ask the question, is this relevant? Is this idea right that there is heterogeneity? Well, looking at our data, especially the data from DIRECT, it was very clear to us that if people had a body mass index of 45 and went down to 42, they became metabolically normal and lost their diabetes. If they had a body mass index of 27 and went down to 24, they lost their diabetes. That caused me to think again and to suggest the personal fat threshold hypothesis. And that really is so important. Now, of all the various new concepts that I've thought of and tried to use in the clinic, this is the one that your patients will grasp most readily. So many of them might say to you, but why do I have type 2 diabetes? All my friends are fatter than me, and they don't have it. Well, life's unfair, but the reason is that it's this person's own body, and that body can't tolerate the level of fat that is accumulated. But bear in mind, this is a hypothesis. It's derived by sitting in a chair and thinking, and we might be misled. The only purpose of setting on paper a hypothesis is to try and test it to destruction. You try and destroy your hypothesis. That's science. So to destroy this hypothesis, we could take a group of people with a normal BMI, but type 2 diabetes, get them to lose weight, and if their diabetes doesn't go away, well, clearly it's wrong. And that's what we did. So in the next few slides, I'd like to explain to you the retune study. This shows the weight loss we achieved in this group of people who had a body mass index between 21 and 27. They were largely white European origin, just to help you interpret this BMI. And this graph shows not only the weight change, but also allows me to explain the protocol. So, at each time point, we used 2 weeks of the low-calorie diet to achieve the change of state. In this case, a 5% drop in weight. Then we kept weight steady for 6 weeks, and then tested them at that new weight. We then repeated this 2 weeks of low-calorie diet, another 5% weight loss, tested them after the 6 weeks of normal eating, and here is this. Those people who hadn't yet reversed were then asked to do a third cycle. In fact, that was a small number of people, and that is something of a distraction. Because over the 6 months or more, up to 1 year, these people remained exactly the same in weight. Lower BMI people who are asked to lose weight can do it very easily. They keep it off almost without effort. It's quite different from trying to persuade people who have shown themselves capable of becoming very large. They find it genuinely difficult, just because of the people they are. It's no fault of personality, it's just how it is. So, there was one critical finding of this study that I've shown in red here. These people who had a normal body mass index had a total body fat composition of 32%. Their doctor thought that they had a normal body fat because of BMI. But this measurement shows that it's grossly raised. Here are the matched controls, and you can see that it's down at 25%. Whereas even after the weight loss, it was 28%. Well, what happened? Well, this is what happened. Here we have someone who had already lost weight and in fact lost their diabetes. But there is still lots of visceral fat in this MRI scan of the abdomen. But the control matched for this individual. Look at the visceral fat. There's a tiny bit here. There is hidden fat. Now that isn't metabolically important. But what is important, if it's too great, it spills into the liver. And that's what we had gotten rid of. So the liver fat went back to the normal level. 70% of people normalize their HbA1c. So you can see that the road ahead is clear. We're dealing with a disease which is simple. It is nutritionally based in those genetically susceptible to it. It's capable of being set back to normal. So from this talk, I would leave you with just 2 conclusions. Firstly, type 2 diabetes is caused by having a little more fat inside your liver and pancreas than you personally can bear. And understanding this simple etiology helps guide management of all kinds. The initial explanation to your patient, if necessary, the choice of drugs. It helps understand, and that understanding is the basis of providing sound patient care. Thank you.
Thank you, Dr. Taylor. Now I call upon Kamlesh Khunti. Simple step